Dr. Dan weighs in on privacy between you and your doctor. Can you record your doctor's appointments? Hi, everybody, and welcome to Dr. Dan and Daily. I'm John Daly. He is Dr. Dan, MD, MBA, and soon an author. So, Dan, tell us where you're at.
Hey, John, great to see you. I'm right here in Nashville, Tennessee.
All right. Well, let's dive into the topic here because there are plenty of recording artists there in Music City. But what if your doctor is against any recordings during his or her performance, let's say? I'm going to dive into an issue here that I encountered. I took my 89-year-old mother-in-law to the doctor's office. The doctor's office had a sign that said, there are absolutely no recordings allowed in the office and during patient sessions. It's curious to me because about a year earlier, I actually took my mother-in-law to the doctor after a serious diagnosis and the potential of a surgery. I recorded the session off my iPhone so I didn't miss anything that my wife would want to hear later about her mom. Now I see that sign forbidding any recording. And if you do record, you cannot be a patient of that doctor. That's what the sign says. So let's dive into this. So Dr. Dan, give me the doctor's perspective. They're more worried about malpractice suits more than anything else there, right?
Yes, absolutely, John. It's certainly a great question. And really, according to the literature, according to the Journal of American Medical Association, it's actually legal to record, even to record secretly. But if you live in California or Florida, you must be able to have consent before you record. And of course, to answer your question in regards to malpractice, absolutely, it's on the top of all physicians' minds in regards to that. So again, the physicians really need to be aware that any conversation that they have with the patient may or may not be recorded. So they have to make sure they're making appropriate statements to the patients, and also that they're taking time to really, watch their tone and how they reflect and how they communicate to the patient.
All right. So check your state laws. That's probably the best thing. Okay. Let's, the perception
Absolutely.
for the patient of the doctor, it kind of seems like the doctors, if they're going to stop you from doing that, is that you're really, you're more concerned about yourself rather than you are about the patient. And then at the same time, too, it just seems there's so little time with a doctor anyway. And I got to think that, if you're in there, you're going to start asking the doc to give you as much information as possible in as short a period as time. So what do you think patients should do to make sure that they're going to get all this information, or when they're confronting this, you can't record, dictate?
Right, John. What I think patients should do is they should prepare questions ahead of time if the doctor has certainly any recommendations and any treatment plan. So again, coming prepared with questions is certainly crucial. And also considering asking to maybe record some of the more important information, maybe not necessarily the whole conversation, maybe some of the important aspects, even asking permission first. And again, if a patient decides not to record, maybe even have the physician take notes, hand that off to the patient. So again, you have that transparency between what's really occurring in regard to their healthcare.
All right, this is Dr. Dan and Daly. He is Dr. Dan O'Brien, MD, also an MBA. You can check him out at drdanmd.com and also on LinkedIn at Dan O'Brien, MD, MBA. So, so could you maybe create your own written agreement between your doctor and you that allows you to do recording, let's say, and you won't post it on social media, it's just for your information? Is that a good idea?
Absolutely, John. That's a great idea in regards to have that written consent between patient and physician. Again, allowing them to record, but again, maybe making sure not to post that all over social media for it to go viral. So I think that's really crucial as far as running a successful business, having that written agreement. Also, just keeping in mind a customer patient-centric atmosphere too is always really crucial when running a practice. And also too, identifying ways to lower HIPAA risk. This is really important. So that could include, to your point, making sure there's a written agreement between patient and physician at all times.
Okay. Is this something that you think you talk to lawmakers about? Maybe we need to create a blanket law that says they can record stuff.
Absolutely, John. I think they can, just because this is really going to improve the quality of care. And that's what's missing right now in this country in regards to healthcare. Is this quality of care. Of course, access to is huge. So if we can improve quality of care and access with these written policies, absolutely, let's go for it.
Okay. Before we wrap it up here, give me your tips of what people should do before a doctor's appointment to make sure that your doctor is more responsive when you only have a few minutes? Give us the Dr. Dan tips.
Absolutely, John. So some of the Dr. Dan tips is make sure to make a list to prioritize before walking in to the physician's office. A list of any questions, a list of any meds is really crucial. And also, John, make sure you bring in a family member or close friend to make sure the communication that the physician is passing along is clear and there's a friend or family member. Also, make sure you're always honest right there with the physician. The more that you're able to tell your story to the physician, the more he's able to kind of give an appropriate treatment guide for next steps. And also complete any lab work prior to, of course, walking in the physician's office. So he's got all the lab work to make sure he knows where to kind of address the diagnosis and treatment.
All right. Great tips. We appreciate it. Dr. Dan, enjoy Nashville.
Absolutely, John. Always great seeing you.
As well, he is Dr. Dan O'Brien, MD, and also an MBA. We're going to be telling you more about some other initials he'll be getting after his name, and also a new book soon. You can also check him out at drdanmd.com, and he is also on LinkedIn at Dan O'Brien, MD, MBA. Dan, thanks so much. Enjoy Nashville.
Yes, absolutely, John. Always great to see you.